Well, the Cleveland Clinic, Lou Rubos Center for Brain Health, is holding a free balance and memory screening event. And joining us with more about what you need to know and who should stop by is Shana Meyer. It's good to have you.
Thanks for having me today.
Well, you work with the Occupational Therapy Program, and you're the Director of Rehabilitation there as well. And they have a state-of-the-art facility, by the way. I've had a chance to stop by. It's just really a jewel in our community. So let's talk a little bit about who you're trying to get out to take part in these free screenings that you're holding.
Sure. We are really looking to help older adults that are aging find out if they're at risk for memory or balance changes.
Yeah.
So with actually falls being one of the number one injury-related death for people over 65, we want more people to know if they're at risk so they can have those conversations with their healthcare providers.
So important. So if you're watching right now and you have an older family member or an older friend, they could really benefit from this because it's free. Did we mention that? So that's always good. But it really gives them an opportunity to kind of assess where they are in terms of their memory, you know, where they stand with that, and also their likelihood to be more prone to falls, which you said are the number one cause of death among older Americans.
Yeah, and they're actually basically risk assessments we'll be doing. We'll be doing risk assessments, and people will come away with a flyer that they can share with their healthcare providers and have those conversations they need to have so that they can start making changes and identifying things earlier so that they're at lower risk of falls or memory changes that could be fixable and treatable.
Interesting. So, I mean, it's just really kind of giving them an idea of where they are, and then if there are issues, here's some things to keep in mind that you can take to your primary care physician so you can start being proactive in trying to address some of these issues.
Yeah, and actually at the end we'll have a resources table where we'll be able to share with people other things that they might want to start trying or things that they may want to say or ask from their physician, like a referral to physical therapy or starting a Tai Chi class or something like that.
I love that. You know, for even the rest of us, you know, even those who may not fall in that older demographic, what are some things that maybe we can be doing right now to just kind of, you know, stay on top of it when it comes to our memory and just being more alert?
It's all about staying active. You have to stay active, and if you're not exercising now, now's the time to start.
I heard that if you, it was just this new study that came out that if you're exercising at least maybe 30 minutes a day, 5 times a week, it, you know, can decrease your likelihood of having some of these onsets of some of these, you know, diseases like Alzheimer's and things of that nature.
Yeah, there are great resources out there. The CDC has great recommendations and guidelines out there for older adults, and they also have information from the Nevada Falls Free Coalition. We have a Facebook page that shares different ideas of how to start being active if you haven't been.
That's great. Excellent. All right, well, definitely check out the event. It is Monday, 1 to 4 at the Lou Rubos Center for Brain Health. That's right in downtown Las Vegas, so it's very convenient to get to. It is free, so definitely stop by and check it out.
Registration is required,
though. Okay,
you must.
Mention that.
You must RSVP. You can RSVP on our website of clevelandclinic.org/Nevada screenings.
We got to be able to get an idea of how many people we have coming, so that's important. Gina, thank you.
Thank you so much for having me.
All right, Heather, let's send it to you.